This is In the Loop. I'm Christian Bryant. We're more than 2 years into the COVID-19 pandemic. Mask mandates have now been lifted in all 50 states, and nationwide, case counts are at their lowest since July of 2021. But even if workplaces and public spaces are lifting their requirements, this pandemic is not over. And with the possibility of another wave starting as soon as a few weeks from now, this lull is an opportunity for health officials to get ready and limit the damage as much as possible. Even as deaths have declined after a surge earlier this year, the US is still quickly approaching 1 million total COVID deaths and is still averaging roughly 1,000 COVID deaths every day. To put that into perspective, more Americans have died from COVID in the last 4 days than in the attacks on 9/11. And there are indicators we might see a rise in cases in the coming weeks. Europe has seen a rise in cases from the Omicron BA2 subvariant, and BA2 is making up a growing portion of new cases in the US. The size of any potential surge could vary regionally, depending on levels of prior infection in a community to whether the population is more likely to spend time outside or inside. But the CDC's new recommendations only ask local governments to reinstitute a mask mandate at a much higher case level than before. And some experts worry that could be too late.
Unfortunately, the country's public health agencies have communicated a confidence level that I don't think is fully commensurate with the data. People need to keep up awareness, and unfortunately, our CDC guidance isn't necessarily interpreted in the right way. I'm not even sure it's provided in the right way so that people keep their guard up.
Dr. Eric Topol, the director of Scripps Research in California, has led research efforts into detecting COVID spread and has done extensive COVID data analysis. He says we're not too far from containing the virus right now, but that we should stay vigilant because of the sheer number of avenues available for the virus to replicate or change.
Well, the virus isn't tired. It doesn't take vacations or sick days, and all it wants to do is replicate and get in living organisms, and as it turns out, not just people, but so many different mammal species that it's invaded.
Adding to the issues, the White House is warning that it's running short on funding for tests, treatments, and additional vaccines. But it's not March 2020. We have more knowledge about which public health measures can prevent COVID spread, and vaccines are widely available. Vaccines are still highly effective at preventing severe disease, hospitalization, and death from COVID. And even with the Omicron variant, vaccines make you less likely to get infected than if you're not vaccinated. But now it's been at least 5 months since many Americans received their last vaccine shot, even for some of those who got boosted. And with studies indicating that immunity can decline after that time, many Americans are wondering if they can receive their next shot. A KFF poll from February found that 35% of vaccinated Americans would get a booster dose as soon as they can, and just over half of those surveyed had plans to get a booster at some point, even if it wasn't required. It's doubly true for the 17 million Americans who received the single-shot Johnson & Johnson vaccine and are currently allowed one booster under current CDC guidance unless they are immunocompromised. It's led to some medical professionals calling for a second booster, including Michael Z. Lin, a professor of neurobiology and bioengineering at Stanford, who has worked on potential COVID treatments and frequently publishes COVID data analysis on Twitter.
A J&J who's been boosted once is like a freshly finished RNA vaccine recipient. That protection is only about 60% some plus versus Omicron infection, and it decays over time. It seems the best thing to do would be to recommend a second booster to J&J recipients, again, around 5 months after their previous shot.
And while booster questions apply to all 3 of the currently authorized vaccines, the CDC has no plans to vote to recommend it yet until more research is done. CDC representatives did not answer Newsy's questions about when the guidance may be changed. Both Pfizer and Moderna have asked the FDA to expand authorization of a second booster shot, with Pfizer asking for a second booster for those 65 and up, and Moderna asking for one for all adults. Until those are approved, however, those who have been boosted will likely have to manage with the protection they have. But at the same time, unvaccinated people can improve their protection by starting the vaccination process. And those who have one Johnson & Johnson shot or 2 shots of Pfizer or Moderna can do so by getting any one of the 3 approved vaccines as a booster. Let's dig into this a little more and get some more medical perspective on what another COVID wave might look like and what we could do to soften its impact. Joining us now is Dr. Jeremy Fauci. He's an emergency room physician at Brigham and Women's Hospital in Boston and an instructor at Harvard Medical School. He's been a vocal advocate for public health measures to address the pandemic. Jeremy, thank you so much for joining us. I want to make you CDC director right now. As CDC director, I would love for you to kind of use your expertise and tell us a little bit about, what you feel like the path forward should look like.
Thanks, Christian. I think that right now, for the first time during the entire pandemic, we actually have a couple of reasonable plans put on paper by the White House itself and also by a bunch of experts. I think both of those plans have a lot of strengths. And the number one thing that we need to do any of them is the funding, because without the funding, it is an intellectual exercise and it's just for people to show that we know what to do, but not that we actually do it. So if I were the one magic wand thing I need to see happen is to see that $15 billion that was pulled out of the funding package this spring back in play, because without that, we don't have the things that we know have worked. Things like vaccination on a mass scale, things like therapeutics being covered for free if you have COVID.
Are we right now doing what we need to do in order to be prepared for, let's say, another wave of COVID? I mean, how would you rate sort of the government response right now?
Improving. It's improving. We didn't have testing at all when this thing started. Then we got decent tests, but not enough of them. Then we got rapid tests in everyone's mailbox who wanted them. We went from an F on tests in February of 2020 to slowly D, C, B. And now I think we're B plus A minus range on tests. We have them, they're around, but we also need to see the wastewater surveillance be in every single community. Without that, I think you're flying blind. So that's a big, huge thing. I think that in terms of the vaccinations, we've actually taken a step backwards. So we had a great rollout of the vaccine early on in terms of, 90,000 vaccination sites that were propped up. And we had these stadiums and we had public community health, and we did pretty decently, although there were huge disparities there. And then we got into the booster era and the disparities got worse. And in terms of things like therapeutics, we have been very bad. I mean, you look at, we have finally therapeutics that seem to make an impact. I think that they work well. We'll see how they play out in real life. But you look at data, who's getting the therapeutics? Literally, the people who are getting therapeutics are young, wealthy people. And the people who aren't getting them, older people of color. Well, we know that that's the wrong recipe, because when you look at disparities and how this is all played out, that's literally what's happened is the opposite.
In our segment, we discussed some of the questions around a second round of booster shots and the development of Omicron-specific vaccines. In your view, I mean, how likely is it that people will even need those? And if so, like, how important will they be to really kind of stop the spread of this virus?
Boosters have been very interesting. The idea that boosters help everyone is kind of true in terms of decreasing infections temporarily. But in terms of decreasing hospitalizations, severe long-term outcomes, the things that we're worried about, the biggest effect by far was 50 plus and people with immune compromised. So in fact, if you take the young people out of the studies, the effect of the booster increases in older folks, because it emerges that those folks needed that third dose in a major way. Whereas younger people, it really was about decreasing infection temporarily, which is a reasonable outcome to go after, except for the question of, well, for how long does that protection last? It turns out not very long. So then the question becomes, if you're just boosting to decrease infections, you better boost when it matters.
Dr. Jeremy Fauci is an emergency room physician at Brigham and Women's Hospital in Boston and an instructor at Harvard Medical School. Jeremy, thanks so much for joining us.
Thanks, I really enjoyed it.